And the first thing I want to tell you is that in men, listen up, 1% of breast cancer diagnoses are in men, not women. Your brother has it. Okay. So, if you are a man of 70 or older, you might want to take a look at the handout or listen up because this could certainly apply to you, unfortunately. In my nursing career, I initially worked medical oncology, which was my first love, and then I got into some different avenues of nursing. So I'm going to talk a little bit about diagnoses, symptoms, and the handout has more information regarding the genetic testing, which I think is a big interest to a lot of people nowadays because it's really kind of a cutting edge thing now when it comes to breast cancer. For somebody who has symptoms and ends up going to their physician to get a diagnosis, the only way you can have a definitive diagnosis for any cancer is through a biopsy. So if you go into a doctor and you're feeling lumps, you're feeling, this, that, or the other thing, he can't tell you when you walk in the door that, yeah, you definitely have a breast cancer. Having a CT scan, a mammogram, a ultrasound, a MRI, those types of things help delineate the potential mass you may have, but biopsy is the only definitive test. That's a yes or no definite. When a person gets that biopsy result, there are several things that they're looking for. And that is to stage the cancer. For people who just have a small, localized little mass and the cells that they look at underneath the microscope look a lot like the original breast cell, that's considered undifferentiated, meaning that it looks a lot like the original breast cell. So that's generally denoted as a stage 1 cancer. When they're looking at these cells under microscope and they see that these cells from this mass don't look hardly at all like a breast cell should look, it's called highly differentiated. That means that those cells don't look anything really like the original breast cell itself. Every cell in our body has a specific look. Your liver cells don't look like your skin cells, don't look like your muscle cells. All of these things are different. So we know what a breast cell should look like. A highly differentiated cell is a worse diagnosis than a undifferentiated cell. Then when they're doing these biopsies, they also generally take some lymph nodes. If they find some of these differentiated cells in the lymph nodes, that's generally viewed as a stage 3. Cancer goes from stage 1 to stage 4, no matter what kind of cancer you have. When they find it in the lymph nodes, depending on the number of lymph nodes, they may well do a full body scan or a PET scan to determine if that breast cancer has spread to other organs. When it has spread to other organs, it's stage 4. The higher the number for your staging, generally the tougher it is to treat. Metastasis for breast cancer, it likes to go into your bones, it likes to go into your liver, your lungs, and your brain, unfortunately. Bone cancer is probably one of the most painful cancers you can have. Liver, lung, and brain are really tough to treat. So it makes it even more difficult for individuals. If you look at the front page of your handout, as I mentioned, 1% of breast cancers are in men, generally age 70 or older. The symptoms people need to be looking for when you're checking out your breasts men as well as women, is there a hard wall? Are there swollen areas that one breast looks much larger than the other? Are there lumps near your collarbone or your armpit? Are there changes in the shape of your breast? Is there kind of a concave looking area potentially? Is there dimpling like a orange skin peel look to the breast skin? Are there flaky, discolored areas looking like a rash on the breast? Is there pain or tender spots to the breast? Is the nipple turned inward? Some women are born with inverted nipples. It can be normal for some people, but they're born that way. This isn't a new finding. So when we talk about that inward turning nipple, it's a new finding. It's not your norm. And is there a discharge from the nipple that isn't breast milk? Again, these symptoms also apply to men. Breast cancer is frequently and most often found in the right upper quadrant of the right breast. I have no idea why that is, but that's what the statistics are. I'm not going to talk a ton about treatment. When it comes to treatment for any type of cancer, generally speaking, I hate this phrase, but it's frequently used. It's the cut, burn, and poison is the phrase that is used. Because they cut off the cancer, they burn it with radiation, and then they give you chemotherapy. And sometimes it's chemotherapy to help shrink the cancer first and then surgery, depending. One thing I will mention, having worked in oncology, there's a lot of people out there that have been given diagnoses, have been given treatment options, and I think one really pertinent question that I encourage everybody to keep in the back of your mind. If you're diagnosed with any type of cancer and the doctor says, we can gain you some time, we can gain you, 3 to 6 months, possibly a year. I think the important question to ask is, what are going to be the side effects of my treatment, and what will my quality of life be in that time frame? I've seen people who have had cancer diagnoses that after several, a month or more, had said, man, if I'd known it was going to be like this, I wouldn't have done this. Because their quality of life is done for you. Some people have said to me, I wish I had just been asked to be kept comfortable and as functional as possible so that I could enjoy the time with my family instead of being over a toilet heating 24/7. It's not fun. Being immunosuppressed, where your blood levels are so low that your immune system is compromised that you can't see people. You're tied to your house with a mask on for fear of catching even a simple cold because it could kill you. So knowing what your quality of life would be during those instances, I think, is a really important thing. Causes of cancer, we have absolutely no idea what causes cancer. Some people think it's an immunocompromised thing. Some people think it's autosomal, kind of like the arthritic type issues that people can experience, or inflammatory diseases that come about. So we really have no clue. There are things that we can do to help lessen our risk for cancer. We can avoid alcohol, we can avoid smoking, we can try to eat a healthy diet and keep our weight at a healthy level. We do know that people who are overweight, who consume a lot of alcohol, who have had exposure to radiation in some capacity beyond what normal people might have for sex reasons, these things, or what have you. Those things can contribute to an increased risk for breast cancer. The things that we can't control, family history, hormonal changes. We're more at risk after the age of 40. So being aware that the older we get, they say that eventually we'll all get cancer if we live long enough, which I just think so. Those free radicals that you hear people talk about, eating those very diets with high colored veggies and fruits and those things supposedly help us. People who have started their periods at a young age and went into menopause at a later age have a higher incidence of breast cancer. People who got pregnant at a much older age have a higher incidence of breast cancer or were never pregnant. Long-term contraceptive use or postmenopausal hormonal therapy. If a woman is postmenopausal and having a lot of symptoms, if there's an option for you to treat these symptoms without you using hormones, it's to your benefit to avoid that. The complications of cancer, especially breast cancer, is spread to other organs and bones. Treatment after breast cancer, where they have removed a lobe or a portion of the breast or a total mastectomy, lymphedema, pain, and sickness are frequent. Lymphedema is one of the biggest factors. Our lymphatic systems are similar to our circulatory system for our blood. These vessels run kind of congruent right alongside, parallel to the blood vessels often. And they help to move the lymphatic fluid throughout our body. When they harvest these lymph nodes, which help with our immune system, what they end up doing is disrupting that flow. So a woman will frequently, you'll see a woman with the enlarged arm, a lot of swelling. Sometimes they have the Job's sleeves that they wear to help compress and help that fluid along. Kind of similar to my lovely TED hose I'm wearing after my knee replacement. Excuse my fashion sense. That can be very, very disheartening. We all like to look nice. We all want to look normal. We don't want our illness to be obvious to people, what we've gone through. Women who have had a mastectomy, lumpectomy, that type of thing, should never have a blood pressure taken on the affected side, if possible. They should never have an IV started on the side that they've had surgery. Unfortunately, there are those women who have had bilateral mastectomies where both breasts have been removed, so your options are pretty limited there. But if it's done on the right, all IVs and blood pressure should be done on your left. Most nursing staff and doctors know this, but every now and then I run across somebody who never asked. So it's our responsibility to be aware of our own healthcare issues and do what's best for us. About 5 to 10% of breast cancer cases are hereditary, which means 95 to 90% have nothing to do with hereditary issues. Many people think, oh, there's no breast cancer in my family, it's not a big deal, I don't need to have that mammogram done, I don't need to do a self-breast exam, because no one in my family has ever had breast cancer. Wrong answer. Only 5 to 10% have to do with heredity. The cancer gene is passed down from a parent. There's hundreds of breast cancers. Unfortunately, we only have a half a dozen or so that we're able to test for at this point in time. If you have the genetic testing done and you come out negative, it doesn't mean you won't get breast cancer. It just means you don't carry predisposition for the gene. If you have the test done and it comes out positive, it doesn't mean you're going to get breast cancer either. It's a 50-50 shot. So doing that self-breast exam, getting your mammograms is really important. You can get a breast cancer gene from either one of your parents. Can be your mother, can be your father. If both of your parents have a family history of breast cancer, your risk is even higher to develop breast cancer. So if your father's mother had breast cancer, if your mother had breast cancer, your potential for breast cancer goes up quite a bit, 50 to 70%. So be aware, it's not just mom's issue or grandma's issue on mom's side. Fathers play a role in this as well. If your parent has an autosomal abnormality for the mutant gene, there's a 50% chance you'll inherit it. So if you're one of those lucky people that doesn't get it, great. When it comes to deciding on whether or not to be tested for the genetic predisposition, you need to really discuss this with your physician. You need to look at the risk factors involved, as I said earlier, and make a decision with your doctor. If you have 2 or more blood relatives, mother, sister, aunt, cousin, daughter, or someone in your family with an ovarian cancer diagnosis, that would suggest you should consider the genetic testing. If you were diagnosed with breast cancer, especially before the age of menopause, and have a blood relative with breast or ovarian cancer, it's recommended that you have the genetic testing. If you were diagnosed with ovarian cancer and have a blood relative who's had ovarian or breast cancer, it's recommended to get the genetic testing. And I can tell you from my experience as an oncology nurse, ovarian cancer I always viewed as kind of the creeper in the night. People didn't have symptoms until it had metastasized. And by then, you're at stage 4. That's ugly. If a person has GI symptoms that just seem peculiar, changes in bowel habits, things like that, that can be one of the symptoms of ovarian cancer. Bloating that just doesn't seem to want to go away. Weight fluctuations along with that bloating. I know there are physicians out there who do hysterectomies and still leave ovaries because they want that hormonal support for the woman. I'll be very frank, it's a decision you make between you and your doctor. When I came time to have a hysterectomy, I had it all gone. I wasn't going to take that risk. I deal with the hot flashes, I deal with the sweats. The idea of ovarian cancer, no, I didn't want to deal with that. I saw firsthand what happened. But again, that's between you and your doctor. That's my personal caveat. If a male in your family has had breast cancer, it's recommended that you have the genetic testing. If you or a family member has had bilateral breast cancer, cancer in both breasts, it's recommended that you have the genetic testing. If you've had a triple negative breast cancer before the age of 60, it's recommended that you have the genetic testing. If someone you're related to, male or female, has had the BRCA1 or 2 mutation diagnosed, If you are of Jewish descent and have a breast cancer, ovarian cancer, blood relative, it's suggested you have to do genetic testing. If you are a Black woman, not that Black women have more incidence of breast cancer, but statistically speaking, Black women do not pursue healthcare at the same frequency that other ethnicities do. So by the time breast cancer is found in Black women, unfortunately, it's generally progressed further. I know some people feel that this is due to financial concerns, insurance concerns, what have you. I will say that I'm aware of free breast cancer screenings that are done in Milwaukee, Green Bay, even at our local facility, Asian Healthcare Assistant. If you cannot afford care, there's community care funding. So to not pursue your health care is not in your best interest, obviously. There are ways around it. There is a Living Smart screening that the hospital used to do that I assisted with years ago when I was still an employee there, and it had a skin cancer screening that was done. And Dr. Bernhal had called me in and said, Laurie, I need you to talk to this woman. She had just moved to the area from Florida, had no insurance, no employment, nothing. He said, she's got skin cancer, and it's ugly. Well, having lived in Florida with the sun exposure and what have you, unfortunately. And I went in and talked with her. We got her hooked up with community care funding and the doctors that were necessary. She had surgery, and she never saw a bill. And luckily, she was doing okay last time I had her. So some of these free screenings can just be invaluable. Mariel and shaking her head. It's true, yes. If you are going to have the genetic testing done, they will have you go through some counseling first to discuss what your goal is with the breast cancer, with the genetic testing, what your plan is if you come out with a positive result. Some people really freak out on these things. I have a family member who actually, her half-brother and her half-sister had been tested, and they both had the BRCA1 and 2 positive. And she was beside herself. And I said, honey, just go and get the test done. Well, it turned out that it was actually on their father's side, not her mother's side, which was the connection to these two individuals, was the mother. So she came out negative, which was a huge relief to her. And of course now the half-brother, he's doing screenings and checking himself and what have you, since he's aware that this is the case. But as I said, only 5 to 10% have a genetic connection. So there's still that 90 to 95% chance to still end up with breast cancer. Who am I going to share my results with? Who am I going to tell? Again, are they going to freak out like this individual did? Luckily, this person had called me. I was able to talk her down off the ledge. Some people have high anxiety. It's a stressful situation. The genetic testing is done through a blood test. You can actually get a genetic test to do with it. It costs between $200 and $300, but it is not necessarily going to test for all of the things that a test that your physician is going to request. The testing in the hospital, depending on your insurance, can cost between $300 and $50,000. But for some people, that peace of mind, I guess, it's worth the money. that big deal with that. Genetic testing is not 100% accurate all the time. There can be false positives, there can be false negatives. The test takes several weeks to do, so there's always that anxiety time frame until you get your results, unfortunately. But having that information can help you make a more informed decision when it comes to your healthcare in the long run. I think we're all aware of, for instance, who is that? She married to Brad Pitt, Angelina Jolie. She had the testing done, came out positive. She opted to have a bilateral mastectomy done. That's an individual decision, I guess. I don't know that I can put it that way, but each their own, right? If you find that you have that genetic predisposition, the best things we can do are maintain a healthy weight, stay physically active, limit our alcohol intake, and if we are still in that childbearing age, breastfeeding has been found to lower the incidence of breast cancer. So for those moms out there that did breastfeed, good for you on multiple levels, including your own health care in the long run. We didn't necessarily know that back when we were pushing breastfeeding either. So, I'm not going to go over all of the genetic things that are in your handout. You can look at those at your leisure. There are some that have a higher incidence of breast cancer, depending on your age, depending on your medical history. The interesting thing as well is men who have tested positive for the BRCA1, they have a higher incidence of prostate cancer. So having your genetic testing done can be a benefit to them as well. So, men are unlikely to have breast cancer prior to the age of 35. Your risk increases with age. Most breast cancers happen in men between the age of 60 and 70. So doing that self-breast exam is really important once you hit that age of 60. If you have a family member, close family, female relative who's had breast cancer, history of radiation exposure to your chest, enlarged breast as a man due to drug or hormone therapy or some infection. If you take estrogen as a man, it increases your risk for breast cancer. Severe liver disease called cirrhosis, which is frequently connected to alcohol abuse, has a much higher incidence of breast cancer in men. Diseases of the testicles, such as lumps, orchitis, testicular injury, or an undescended testicle at birth, has a higher incidence of breast cancer. And obesity. And I'm not going to get into what people feel is obesity versus what our medical folks think is obesity. They think my husband hits the obesity scale, and I look at him and think, oh my gosh, they're out of their minds. Again, the symptoms are the same in men as they are in women. Diagnosis and treatment is the same as it is in men as it is women. The other thing I wanted to talk about briefly, and it was kind of funny as I was gathering the information for this talk today, I got an email the next day from a veterinarian. Did you know that your cat or dog could develop breast cancer? I did not know that. So I thought it'd be kind of interesting to include that information in here, given many of us are pet lovers, have those cats and dogs. You actually should be looking at the breasts on your female cats and dogs to look for discharge, look for lumps, look for the dimpling, the same types of things that you would in yourself. Signs include bloody discharge or pus from a nipple for dogs, multiple bumps, painful or swollen breasts, singular lumps, ulceration, yellow discharge, or pus from a nipple. Signs of breast cancer in a dog can be breathing difficulties, coughing, lameness, lethargy, loss of appetite, weakness, weight loss, and enlarged lymph nodes. Same in cats. On the very last 2 pages of your handout, there is information regarding what the recommendations are by the expert groups out there, such as the American Cancer Society, U.S. Preventative Task Force, Obstetrics and Gynecology, Family Medicine, as to what your screening should be. The recommendation is generally a baseline at age 40 for a mammogram. When I lived in West Bend, I met a woman who at the age of 25 was diagnosed with bilateral breast cancer. I was shocked. It's rare, but it can happen. By the time you hit 70 years old, it's kind of between you and your physician whether or not you want to have a mammogram. They kind of look at your overall health and well-being, your life expectancy. If your life expectancy is 10 years or less, they'll generally recommend to cease and desist with mammograms. I get frustrated with my own mother. She's had 1 mammogram in her whole life. She's 81 years old. She stopped going for her Pap test after she had her kids. And I just shake my head. She's run old. I'm not going to get uterine cancer. I'm not going to get cancer. I'm like, Mama, after 40 is when these things happen to you. Need a worse water, can't make her drink it. Her decision. I go. I encourage you all to go. That's pretty much all I have for you today. Any questions or anything? All right. Well, thank you so much for listening, and I hope you all get your screenings and do your exams. Share the information with family members, brothers, uncles, dads, sons. Thank you.